this session, Healthcare from Your Armchair, is brought to you by Healthwave, who are the guys who are leading the people-powered transformation of healthcare, which sounds pretty cool. And hopefully you'll hear a little bit more about what that means in a second. We're going to be today finding out how people can do their daily basics online, and especially with a focus on healthcare. So we're going to be exploring what's happened since the pandemic, and also finding out new ways that people are being able to look after themselves and others through the power of digital. So I hope you'll find it interesting and informative. We're going to be covering a few different topics. First of all, we're going to discover what a digital carer is. Who are they? What are they? Could you be one? We're going to hear some exclusive research from Healthwave, from Ollie Sleeman, one of the directors. I'm going to introduce Dan, our new community manager. Dan, do you want to give a wave? and he's going to be talking to Laura, who we're delighted to welcome. Laura is the Chief Executive of Memory Matters. And with Dan, they're going to discuss the impact of digital, and particular how it can help and connect the older generation. So I think that sounds quite interesting. We're also going to show you a brand new way to get health information and digital resources from, especially in your area, so you can find out how you can get the healthcare you need when you need it. And then finally, we're going to speak to Dr. Rohan Simons, who is Rohan. He's going to reveal how you can get healthcare from your armchair, and why it's so important that you engage with this and get familiar with it, because it could be a very big part of the health landscape in the future. So hopefully you'll find it interesting. We're kind of going to aim for about 3/4 of an hour, and there's going to be a question and answer session at the end. So please do join in. And if you've got any questions in the meantime, stick them in the chat, and we'll do our best to sort of tackle them as we go through. So, but first of all, I'm going to bring in Ollie Sleeman. Ollie is a founder and director of Healthwave. And Ollie's been doing some research on this whole concept of digital carers. So Ollie, perhaps you can just start off by explaining what is Healthwave, what you're trying to do, and then perhaps go on to just talk a little bit about the research.
For sure. Thanks for the introduction, Dawn, and welcome everyone for joining. So yeah, as Dawn mentioned, I'm Ollie, one of the co-founder and directors at Healthwave. There's this really big thing going on at the moment where services are evolving, and the people that are intended to be supported by those products and services are often being disconnected, and it's becoming increasingly difficult to engage and connect with people about that, why that is happening. And so at Healthwave, what we're doing is we are pioneering people-powered transformation, making sure that people are right at the center when designing new products and services.
Okay, so you've done some research that kind of backs up some of what you've just said. I was wondering whether you could explain, first of all, why you did the research, and then perhaps you could share, I believe you've got some slides you could share with us.
Yeah, for sure. The research wasn't initially intended to find out about digital carers. What we wanted to do was to understand how COVID had actually impacted how people were generally engaging with particularly healthcare services. And it was as part of that research that we discovered this phenomenon, this concept that we originally thought about and dived deeper into, that people in their millions were helping others in a very sort of informal way to engage with these new services, these new digital services. And as we'll sort of go on to explain, that role is far from passive. You know, there's lots going on in that space. And we think that if we can support digital carers in the way that they need to, that can have a particularly dramatic impact on people getting the help and support that they need.
So do you want to take us through? You've got some stats, haven't you, prepared?
Brilliant. Thank you, Nick. Brilliant. Right. So all of us watching today, I think, will have observed the fact that a lot of face-to-face services are starting to move online. In fact, since the pandemic, we've actually seen a 7-year acceleration in digital services. And as I mentioned earlier, Healthwave has been working in healthcare, which has also seen a lot of dramatic changes. So people will have seen that appointments can be booked online, that medication can be booked online. There's ways of monitoring conditions remotely at home, and that's just to name a few. Next slide, please, Nick. And so our research that we actually conducted last year, it was towards the end of last year, uncovered that millions of people in the UK need some kind of support to use digital services, whether they're young or old. You know, the picture that we've got there is probably quite familiar to some of you. And we found that up to 30% of adults in the UK are helping others with the online basics. And we found that throughout the UK and probably all over the world, that there are a number of more formal digital champion type programs, but less in the way of formal activities that are happening every single day. And whilst we as the general public might not consider ourselves as carers in this role, we are looking after another person. And with the risk of people being disconnected, giving this sort of increasing reliance on technology in our daily lives, this role of a digital carer is a significant one. Next slide, please, Nick. And we found that this role is far from passive. So in fact, a quarter of people that are helping others in this way are doing it every single day. And we spoke to so many people who shared their experiences, and many of us on this call will have personal experiences too, from helping people to read the electric meter, adding apps to phones, how do I contact my doctor, showing them how to Google, and even explaining what cookies are. Next slide, please, Nick. So we've observed that the delivery of digital services and the work to increase digital literacy is often seen as too hard for quite a lot of organisations, particularly to resolve on their own. And that's why we at Healthwave are pioneering people-powered transformation, and we're starting with healthcare. So to support this army of digital carers, we've enabled a ground-up approach, and that takes the form of a variety of different approaches, but in this case, we're talking about providing a community to support digital carers who are already providing that vital support to others. And that approach provides people with really simple, non-technical solutions, so hints and tips that people can share with one another. And you're all very welcome to join the Digital Carers group on Facebook, and I'm sure after the call we'll share those resources with you. But we passionately believe that just those small changes in this area could have a really significant impact for those that need to access the support and those that need the support to do this job. Thank you, Dawn, and thank you, Nick, for sharing our slides.
Thank you. It's very interesting thought, isn't it, that as the world accelerates towards more digital services, nearly a third of this country are at risk of getting left behind and disconnected from the help and support they need. And I suppose that's why we're really interested in this subject and what it all means. So thank you, Ollie. That's a really interesting piece of research. I'm now going to hand over to Dan, who I mentioned before is our new community manager, and he is going to chat to Laura, the Chief Executive of Memory Matters, about what they're doing in this space. Dan.
Thank you, Dawn. And thank you, Laura, for joining us today. So everyone, Laura's the CEO and co-founder of Memory Matters. They're a incredible CIC based in the Southwest, and they support people living with dementia to thrive in their communities. Memory Matters have a brilliant niche about them. They provide cognitive stimulation therapy. So for those that don't know, that's a NICE accredited and non-drug way of slowing down the progression of mild to moderate dementia. So welcome, Laura.
Thank you.
Hello. Now, Laura, everybody tells me, and we've just sort of touched on it a little bit then, that the elderly can't work technology, but I think you've got a fantastic little story that proves otherwise.
Yeah, so at the height of the pandemic, or it was March 2020, we realised that we would be having to move everything online. So just to sort of back step a minute, just to give you an idea about the services that we provide, they're in community rooms, usually in sort of church halls. So you'd have 8 people in a group and a facilitator, 2 facilitators who lead the group. And the whole point of Memory Matters is that it's fun, you know, coming together socially to have fun. And we do some stuff behind the scenes which helps people think differently and create new connections in the brain. So then let's get to 2020 March and we're thinking, what are we going to do? How on earth do we reach the people that we've been supporting? And we had over 70 people that we were seeing in various places around Cornwall, and the team moved really quickly. So within 2 weeks we had most of our groups online on Zoom sessions. We had no idea how we were going to do it, but actually to start with we just thought, let's just get people connecting again, because we realize how important that is in terms of isolation and the risk of isolation. So the thing that's really interesting, that I find most interesting, is the fact that it was the team actually that were concerned about getting online, and had been, you know, years before when I'd said, I think this could work online. We had this sort of, oh, no, we won't be able to get older people online. It's not going to happen. And it's interesting, this idea of friction versus value. If there's friction, we won't do it. But if the value is higher than the friction, then we'll go on. And this is what happened to our team. So before it was like, oh no, it's too hard, we can't possibly do it. But when we realized that we couldn't see people in their homes or in community rooms, we would have to. The value was far, far greater, and therefore we managed to push ourselves through all the pain that we thought it would take to get people online. And actually, it was a lot easier than we thought it would be. So, sorry, Dan, were you going to ask?
No, I was just going to ask, yeah, how did Memory Matters as an organisation, how did you support your groups to go online?
So what we did is we sort of searched, you know, how are we going to do it? It's the first thing. So we looked at all the different things we could use. We could use Zoom, we could use Teams, Google Meet. And at the time, Gmeet just wasn't up for it. Teams was just too tricky for people to be able to, you know, when you're talking about friction, it was just almost impossible for people to get on. So it had to be Zoom, and that wasn't that easy either at that point. So what we did is we started pulling some instructions together, taking photographs of each step so that we could step people through what to happen. And we spent a long time on the phone. And I think Dan was telling you the story of getting a 90-year-old gentleman, and he was online, and he was so proud because he'd bought these noise cancelling headphones. So he had these noise cancelling headphones on, and I could see him on Zoom, and he was saying, Laura, I can't hear you. And the reason he couldn't hear me was because he had the noise cancelling headphones on and they weren't plugged in. So I was shouting, plug them in, John. But so there were lots of really fun stories in sort of getting people online, but we just kept going and kept trying. And so we got about 80% of the people that we support online during that time, whilst other organisations, including the NHS, were saying, no, it's not possible, there's too much red tape, we can't do it. So I think we did prove that if you sit beside people and teach them how to do it and reduce that friction, increase the value, then people will do it.
So it's probably safe to say that Memory Matters became digital carers during this time. What would you say the positive impacts of being a carer digitally are?
So I think it's that if you're willing to overcome what we see as a barrier for someone else, then there's a lot that you gain from that. So I think, you know, it's very easy for us to say that's too hard, I'm not going to do it. But if we're doing it for somebody else, if we're seeing that that person is going to gain value from it, then that gives you, I guess, as the digital carer, that feeling of, well, I've helped them, I've got them, you know, connected, I've reduced their isolation, or whatever it is from the tech that they're using, the value that they'll get from it.
And you just touched on isolation there. What would you say, like being isolated, and especially during the pandemic, that was such a big thing. What can that do to your health?
So I think, you know, that's probably one of the biggest drivers for us. Is isolation is the equivalent of smoking 60 cigarettes a day in terms of health. So we could not have our beneficiaries being isolated for that long amount of time during lockdown. So we know that that isolation is, I've got a quote here that it's like the fertilizer of disease, basically, isolation. We know that we get worse when we're isolated, and it has a biological effect as well on us.
And what would you say the importance of what you've done for the elder generation, obviously on this subject alone, but what's the importance of them staying connected?
Really, really important. And I think particularly when we're talking about dementia as well, so we know that we're hardwired as humans to be with other humans. It's really important for our health. And the opposite of that, of course, is isolation. So really important. And I think as you get older, your risk of isolation increases and increases. And we never expect to be isolated, but it happens. And it happens to some of us overnight, the loss of a partner or the loss of a network. So it's incredibly important.
Yeah, that's brilliant. And I mean, I know a little story as well. I believe there was a woman, was it, they celebrated her 100th birthday online with Memory Matters as well?
Yeah, she absolutely did. And it was amazing. And she was totally isolated, living alone. So being able to give her a birthday party online was something else.
Fantastic. Yeah, you've disproved that the elderly can't work technology, that's for sure.
Totally can. We just have to get over our own barriers very often.
Yeah, brilliant. Well, thank you so much, Laura. I mean, well, just to sum up there, I mean, you've answered it yourself, but I think you've proven that being a digital carer can be a massive success. Brilliant. Thank you so much, Laura. Thank you for your time. Hope you all enjoyed listening to Laura's expert insight. I'm going to hand you back to Dawn now. She's going to show you a cool and exciting new way to access our health and resources online.
Thanks, Dan. That's an amazing line. Isolation is the fertilizer of disease. That is just a brilliant line. I'm going to be using that in all my social inclusion stuff. That's really good. Thank you, Laura. That was really fascinating. So at Healthwave, we've been thinking really hard about how do we close the gap? What can we do to transform the way people engage with services and support that they need, in particular in the health space. And because we've got lots of clever friends, not me, but lots of clever friends, we've invented a new thing, and it's called the Healthwave Resource Hub. And it's a way that people can find out about all the resources and help and services they need in their area. It's particularly useful, I would say, for digital carers who might be sort of thinking, oh my God, this is so much hard work. Where do I go? Where can I find information? You know, perhaps my broadband's not good enough to help this person, and so on. So this hub is designed to help you on some fundamentals, but also it's locally tailored. So there's different versions of this. We're showing you the Black Country version, but that we've got other hubs available, which we'll share the link in the chat, and we'll also send the link out after this webinar, so you can have a look yourself. So if I just take you through on a quick whistle-stop tour of the hub, Nick, if you want to scroll down, so you can see that we tell people about sort of events that are happening. This is a really great part of the hub. This is our video ask spot, and this is the way that you can find out answers to questions, not by having to read loads of text, but actually through video, which more and more people are saying, I just want to watch a video, I don't want to have to read loads of stuff. So this is showing you how to use the NHS app. If you click, Nick, on what does the NHS app do, you can see how it works. If you click, you get the answer. So Katie there will sort of talk you through what the NHS app does. And if you explore the video ask, you can find out loads and loads of different stuff. So if you keep scrolling down, there's a link to download the NHS app. So if you weren't sure where to get the app link from, which is obviously for some people can be quite a challenge, there's a link so you can just download the app directly. And then if you keep going on, there's a link to our Facebook community. So this is the Digital Carers Facebook community. We've got hundreds of people on there who are all sort of keen to help each other out, either with their loved ones or friends, or just help other people out who are struggling to help their loved ones and friends. We jump in once or twice a week and we populate it with helpful advice, links, information. So trying to sort of tackle that sort of isolation question and trying to provide helpful information and advice. And actually lots of the people in the group, you know, come up with brilliant ideas and brilliant advice to help other people out if they're trying to help someone in the kind of context of digital caring. So if you kind of go on, there's tons of NHS resources on the hub. If you keep going on, as well as we've locally tailored it. So this one, we've got help and information from the Walsall area. So there's things like digital skills training. So there's courses people can go on. There's links to Walsall College where they'll help you download or use the app. And there's also other things like funding for computers and broadband and so on. So funding to help you overcome the challenges if you or a loved one is digitally disconnected. So if you keep on scrolling down, Nick, so you can see there's lots of different stuff. We're adding to these hubs all the time. So anytime we find something interesting, we'll pop it on here. If you're a digital carer or you see something on the hub and you think, oh, that's interesting, you know, my mum or my dad would like to know about that. There's a really easy way you can share the information. So you just click on this little toggle. You can click a few different articles. And then in the top right hand side, you can see the little sharing icon that makes it really easy to just ping it across to someone to give them the right information and help. So yeah, we'll send you a link for the hub in the chat, but also on a follow-up email afterwards. And if it's useful, do have a look at it, share it with others. And if you have any feedback on it, please let us know. We'd love to hear from you. This is a brand new hub that we're constantly improving and innovating on. So any feedback, welcome. Thank you. Okay, so change the mood a little. I'd like to now introduce Dr. Rohan Simons, who's another director of Healthwave. Rohan is going to sort of talk to us a little bit about how we can all get healthcare from our armchair, because I'm certainly lazy enough to need it and want it. So Rohan, tell us a little bit about your role in Healthwave and sort of what you're doing in this space.
Thanks, Dawn, and good to see everyone. It's been some really great examples of how we can make a difference for people who are potentially at risk of being cut off by all of this change that's been going on. My role is as one of the co-founders of Healthwave, and before that I was a full-time NHS clinician for 20 years and had some leadership roles in NHS services. And I think one of the main reasons for doing this and starting this work was it was really hard to get those patient voices into those change processes, which made actually making things better really difficult. And also, what this is going back before the pandemic, we saw that there were some really big challenges on the horizon about how we're going to cope with the future of all these changes that were going on with healthcare. And what we've seen is all those things have come home to roost in one big hit with this COVID pandemic. In practice, what that meant at the time was that, you know, services were pretty much just switched over to digital overnight, and that sadly left a lot of people behind. We've all experienced that in different ways. And so when we first started doing this work, it was really to make sure that people were included, as that great switch of services had happened so suddenly to digital, amongst other things.
So Rohan, the NHS app has been on the rise, especially I believe since the pandemic hit. I understand, I might have got this wrong, that almost 40% of people in some areas are using us. Can you tell us more about the app and what it's for?
Yeah, sure. I mean, the NHS app is essentially it's the digital front door to the NHS, and it was developed a few years back and really became quite popular overnight when the COVID passport was made available through the app. But looking ahead, this is the way we're going to probably access healthcare in the future. So it's really quite a quiet introduction, really, to the NHS app. But really, it's how we're going to that's how we're going to access care looking ahead, really. So it's hence we're really sort of focused on the app and how we can make sure that people are supported to be able to use that effectively. I suppose you'll ask me what it does next.
I am going to ask you. So, I mean, I obviously used it. Well, I thought I was using it when we did the COVID passport was introduced. So I was a little bit overly confident that I knew all about it, and then I realized I was using the wrong one, and that wasn't the NHS app, and the NHS app was a different thing. But what is the actual NHS app for, the main one? What kind of things does it do?
Yeah, so the NHS app is really so when people think about getting healthcare, they naturally think about seeing a doctor, seeing a nurse, and for anyone that's worked in healthcare or has had to access healthcare services, they know that a lot of the things you need to do to access care don't involve another person. So it's things like ordering prescriptions, changing appointments, chasing up results, chasing up referrals, asking, simple questions about your healthcare, updating your, I mean, the list goes on and on. One of the other important things that we've been talking about today is helping other people and getting permission to be able to support dependents, whether they're sort of children or older people. So these are all things that are quite bureaucratic. They involve a lot of often form filling or sort of phone calls, and to a certain extent, the app really is a opportunity to make that all those sort of processes really quick and straightforward. I mean, we're all used to sitting in our armchair, armchair, and accessing banking, doing the shopping, amongst lots of other things. But with healthcare, it's been a lot slower to happen, and that's because healthcare is really complicated. So the app has got many of those features that start to allow that to occur. A lot of people may have tried using the app to order prescriptions, but also you can do a number of other things. And one of the things that people might not be aware of is that you can access the NHS Healthcare A to Z, and that is essentially is a whole resource that you can use to answer simple health questions. Often people will go to an appointment and be told something medical. It's quite technical, and they'll really want to sort of find out more. They might not have had enough time to ask questions, or they'll want to go back. But the Healthcare A to Z really can be a really good resource. So you can look up the thing that's worrying you on there, read about that, and start to get clued up.
What about just thinking about the sort of role of digital carers? Is it possible to get prescriptions for somebody else, or share their health information so that you're helping them manage stuff? Is that possible?
It is possible to do that. The way that's done is through something called linked profiles. So that is something that we're going to include on the Resource Hub, so that you can be walked through the steps that you need to take in order to be able to do that. Including, how you actually get access to the NHS app in the first place. A lot of the time, there's a lot of barriers that people face accessing the NHS digital front door, and it could be anything from a lack of skills or kit, or it could be a lack of awareness of it. And also, I mean, some people really have huge barriers, and that's where digital carers come in. So via those linked profiles, you should be able to start to make that difference and help those people that really need the help.
And in terms of the barrier of the NHS app, I mean, I'm lucky I've got a smartphone. Obviously, lots of people do, but not everybody does. How easy is it to get the NHS app and then get it working? Is it, because thinking about my dad, he's 86. He thinks of himself as a bit of a silver surfer, but other people maybe not so confident. Is it easy to do, or is it complete nightmare like setting up your online banking?
Yeah, well, it should be straightforward, but as we know, sometimes these technical things can really create a barrier and a challenge. So what we've done is create how-to guides step by step, And that's the sort of thing that we'll be able to distribute on these resource hubs, so that people can really start to sort of get a foolproof guide to how you go through the steps to access this resource.
Right, okay. Laura, just to bring you in for a second, is the NHS app something that, you know, the people you work with are sort of aware of? Do you get a lot of questions about it? Because it would seem quite important to, you know, especially dementia sufferers.
No, and I think I'm really aware, myself included, that sort of not and sort of until sort of Dan introduced me, that I wasn't really aware of it either. So I think that there's a real sort of awareness raising that needs to be done, because we coming across carers all the time who would be digital carers that would sit exactly within that sort of space. Yeah, I'm not seeing it as a problem yet, but what I'm seeing is that people aren't necessarily knowing that it's there, and it's such an amazing resource, isn't it, to be able to do what essentially the app allows people to do.
And Ollie, is the NHS app, is that something that the NHS are really pushing forward on, or is it something that will just sort of sitting in the background of health? Is it a priority, or is it something that might just sort of fade away?
It's really interesting because in fact, last year, the NHS app was the most downloaded app in the country. Would you believe it? You know, on top of all the others, it was the most downloaded app. What drove that, do you think? It was the COVID pass. So now that is less of a priority, there is a concern that, you know, retention, i.e. people using the app, might drop. So one of the key things actually is making sure that people are aware of all of the other features that are available in the app, not just the COVID pass, but the health A to Z, booking appointments, repeat prescriptions, link profiles. And we know that speaking to teams within the NHS, that they have a feature list as long as their arm, you know, to bring new technology and new features into the app. Like, you know, it wouldn't surprise me at some point that we'll be able to check, okay, what are the waiting times at hospital? You know, let's go to the app. You know, so there'll always be things coming down the line. And it might well be in the future that you can access other health services via the app. So the app is the front door, but you can access services from, you know, all sorts of other healthcare provision.
Wow, so that's quite big, isn't it?
Absolutely, yeah. And you know, we've got a big job on our hands to make sure that everyone knows about this app. Like you said, Dawn, you know, 40% of the population might well have downloaded it. In some areas, that's a lot lower. In some areas, it's a lot higher. So there's going to be patchiness. So we need to really target those areas to understand what the barriers are. You know, they might be different from one region or another. And then working with our colleagues in the NHS to make sure that the feedback that we hear on the ground, why people might not be using it, is fed back to them so that they can improve the app, so that they can help raise awareness, etc., etc.
Interesting. Now, I hope I'm not going to embarrass him, but John is on the line. John is a researcher, lead researcher at Healthwave. And John, I was fascinated by the research when I saw it around the area of digital carers. Can you talk a little bit to, you know, how much people are using digital devices and you know, how big that barrier is or not? Because you kind of got some numbers on it, didn't you?
Yeah, I mean, the use of digital devices varies across it. I mean, we could stick to the app, I suppose, specifically. The figure does go up and down across the country, as Ollie alluded. I mean, if you were trying to just think about the barriers, though, we did summarize them, I think, through the work that the company's done in 3 ways, which was the barriers that are technological, the barriers that are kit related, and the barriers that are effectively almost psychological, if you want. So some of the things are, I won't say call it simple, but access to kit and internet speed is one of the barriers. So you may not have connectivity on your phone. Your phone may not be of the ability to access particular services to do with the age of it. Might be in a rurality issue as well. So it might be to do with your location. And the other main barrier really is sometimes you'll find groups of people who just don't feel confident using bits of technology, that they might need a bit of training, or it could literally just be a mental block that they have.
And is that age related, John? Is it to do with older people, or do you see, you know, groups of younger people?
Well, it's a funny thing because we do interviewing and survey and community work across different bits of the whole country. You find different trends in different localities. So in some areas that might have a trend towards more elderly people, you do find some of those, but equally it's not exclusive. So sometimes we'll find that there are patches of people who we interview who are a younger demographic and have just decided they don't want to use particular types of technology. They might prefer one particular application, and they're not particularly interested in email, for example. And one method might work in one location for one demographic, but you can switch to another part of the country and you won't have exactly the same answer. So it's that sort of granular, local, neighborhood level information that becomes, you know, really important to understanding how to increase the uptake of a service.
It's interesting, isn't it? It's sort of, we've got to the end of the sort of areas that we wanted to talk about today. I just wondered if anyone had any questions, anyone in the audience, or anybody just wanted to ask our experts anything that sort of particularly struck them about what we've talked about.
I've just seen a bit of feedback in the comments. Becky was with us, she did have to shoot, but I thought it was just nice to read out. She thanked us for an interesting session, but also great to hear of the examples which prove how accessible digital is, and it isn't always an inferior offer to face-to-face. So I thought it was a nice bit of feedback.
That's good. That's really good. Thank you, Becky, even though she's gone. Any other questions or thoughts or reflections on what we just talked about?
I was just going to say, sometimes it's about how we frame the question about digital, particularly when it comes to, you know, accessing healthcare. You know, if you ask people how they want to see their doctor, you know, I want to see them face to face, right? If you say, well, you know, how would you like to order your repeat prescription? Well, you know, I just want to do that from my home, you know, from my armchair. So I think there's a lot of sort of framing around how we actually ask the question. And then I think the other thing, just around a sort of general awareness raising of these types of services, is that we don't just take a blanket approach, because that won't always land with people. I think, you know, part of marketing in a way is that you appeal to where people see value. And so part of the work that we've been doing actually around the NHS app is making sure that we're targeting particular audiences and telling them about the features and benefits that mean something to them. You know, that a repeat prescription for someone who's relatively healthy and young, you know, why do I need the NHS app? Actually, you've got the Health A to Z in case you might have a sensitive issue, you know, or something that you want to keep in private. What a brilliant feature. So it's making sure that we tailor the messaging to the audiences that we want to be able to get to.
Yeah, absolutely. I think just in addition to that, sometimes you know, going back to the barriers, when you register for something like the NHS app, there's quite a lot of, and there's quite a lot of security to go through, because, you know, it's sensitive, potentially sensitive information. And one of the things just people might come up against is needing to know your NHS number, but that is now extremely easy. You can literally go on a special link and type in your details and get your NHS number. So it's a specific barrier. If you're coming up against that, and you're thinking, you know, how on earth am I going to find my NHS number? Well, we'll include that link on the hub, and you'll be able to find that and get access to the NHS app and start to have a look and use it and start to feedback, and hopefully, you know, start to get the benefit of that resource.
Rohan, I don't know if you'd know the answer to this question, but is there any evidence yet to say that the app is reducing demand on things like GP surgeries? Is there any, you know, sense that actually people are starting to use it as an alternative?
Yeah, well, we've started to see that in Walsall. We've been starting to pilot these approaches, and what we've seen in Walsall with this early work is that when people download the app, they're actually more likely to use it and start to use it in ways which reduce demand on the service. So a good example of that is ordering prescriptions. A lot of the time when people need to order things like prescriptions, they'll pick up the phone, they'll ring the surgery, they'll wait in the queue, speak to a receptionist. It might end up turning into a task internally in that surgery. Whereas using the app, they can order the prescription, it's automatic, it goes through electronically to the pharmacy. So that's just one example. And not directly related, but another thing that's really started to emerge is that the number of car journeys is coming down. So, I mean, I don't know if anyone's tried to fill up their car recently, but that can only be a good thing, not only for the environment, but also for our wallets. But yeah, so there's been a big reduction in car journeys from people who are starting to use those automated services. And what we're also seeing, which is really exciting, is that behind the NHS digital front door, there's starting to emerge lots of a range of things that you can start to explore. So we can start to go into that in more detail, and hope that starts to drive that automation and save time for the NHS, save money for people, and save things like car journeys for the environment.
What about, Rohan, the naysayers? So, is every GP surgery bought into this, or are there a bunch of refuseniks who want to see their waiting room full of lovely patients? And if you find your GP doesn't seem to be up to speed with the app, what can you do about it? If you think actually this could be a really good solution for my prescription or my dad's prescription, is there a way of sort of getting the system moving, kind of thing?
Well, I think this is a really good question, Dawn, and I think that there's definitely more work to do on making these services slicker and more integrated with the system. I think things like, I would say that most people would find things like ordering prescriptions, accessing the health A to Z, accessing their record, they should find those things fairly smooth. If not, then it's definitely one to feed back. And they can either, if they're in the Black Country, they can feed back via the platform, via the Resource Hub, or by all means make an inquiry to the surgery and find out why there might be an issue. But most often than not, when we've found there are barriers, it's due to issues with downloading the app or using it, or knowing how to link profiles. So these are all things we can help with, and these are all gaps that we can start to fill.
Okay. Interesting. Okay, well, it's 1:45 now. We're at the 3/4 of an hour. If anybody's got any questions, do let us know. But otherwise, we'd like to say a massive thank you to Laura in particular for joining us, Dan, Ollie, Rohan, and the team for putting this all together. It's been a really interesting session, and certainly if there's anyone watching who's got any questions or has any other ideas of things they'd like to sort of investigate or focus on with its new emerging area of health, we'd love to hear from you. We're going to send everyone after this session a little email with useful links, recording, and also links to the Resource Hub. And we'll be using this content that we've recorded here today to sort of reach out to different areas of the community and talk to them about this emerging area of health, hopefully to get things pointed in the right direction. So thank you very much, everyone. Fantastic session. See you all soon.
See you soon.
Bye.
Bye.